Hi everyone, Nigel here from Hand Pain No More. Today I want to share with you quickly on this condition called mummy's thumb. Where is it? Up here, yeah, mummy's thumb. Medically termed as Quervain Tenosynovitis. It's a really common condition. Actually, we treat a lot of this condition in our clinics. So not to worry, it's treatable. 95% of patients, up to 98% of patients, hand therapy will be able to resolve this problem. So what is mummy's thumb? So if you see image A over here, mummy's thumb is basically inflammation and pain of the tendons and tendon sheath in your wrist crease below the thumb, right? This tendons and tendon sheath is easily damaged, easily inflamed, easily irritated. If your work, your hobby, your activities daily uses a lot of your wrist and thumb, right? So when there's a lot of inflammation, what happens is that there will be swelling and pain. And with swelling and pain, if you don't treat it, it gets more and more painful, right? So the common symptoms that patients always will complain about, number one, on top of the list will be sharp pain, right? Especially when it's freshly acute, that means you just got it, or when it's a new re-injury, or could you call it new injury, or a re-injury of an old injury. You will feel really sharp pain just at the point of the wrist. I have patients crying to me before because of this, because they just don't understand how painful it can be. It can be really painful. That's number one on top of the list. Number two, it is pain-induced weakness, where your body decreases the strength of your wrist so that you don't aggravate this condition. Okay, so these two are the main key symptoms. There are risk factors to develop the Quervain's or mummy's thumb. The four key risk factors are being a lady, being female, being 40 or over. When the older you are, the more you have used your wrist. Number three, if you have jobs or hobbies or passions that involves a lot of repetitive tasks that involves your wrist and thumb, right? Number four, if you are the primary caregiver of an adult or children, that means that you repeatedly put strain on your wrist to carry them, to lift them, to change them. So these are the four risk factors that causes you to be more at risk for developing the Quervain's, right? So what's the diagnosis? How do I diagnose it? How do I know, right? So the main way to test for the Quervain's is this test called over here, Finkelstein test. You see in image B over there, right? So it's very simple test. You just put your hand like this, bring your thumb into your palm this way, like this, and then you just close your four fingers over. Then you just push your thumb away from you, downwards this way. Okay, again one more time, this way. So for most of us, most of the time we just feel like a pulling, mild achy pain, and that's fine. You can just leave it be. But for patients who have mummy's thumb, who have Quervain tenosynovitis, this will be really sharp pain. Patients will complain of pain that about 5/10 in intensity, all the way to 10/10, right? If you have pain in your wrist over here, that's above 5, you should already consider seeing a hand therapist like us or seeing your doctor and get treated. It can be sorted out. So when you know you already have the Quervain's tenosynovitis or mummy's thumb, right? So then what do you do next, right? So you have two options. Option one, which is invasive. Invasive, there's two of these, which is injections or surgery. I recommend patients for injections and surgeries when the pain is so bad, 9/10, 10/10. They're so intense, they can't zip, they can't brush their teeth, they can't wear their brow, unfasten their brow, they can't comb their hair without having sharp pain. They should consider getting an injection first to bring down the pain. And if the injection brings down the pain permanently, great. If the injection doesn't help with the pain, then they can go for surgery or they can do injection combined with hand therapy. 95 to 97% of the population with the Quervain's do not need injections or surgeries. They will heal with hand therapy. So with hand therapy, you can see what we do over here. Yeah, here. Right? So we start off with an immobilization splint, where we customize a splint for your injured wrist and thumb, where we will immobilize purely. It's going to be a splint from your forearm all the way to your thumb, where we will block your wrist and thumb from moving. This prevents unnecessary aggravation to your injured tendon and tendon sheath. And also, of course, protect you from using it lah. You just need to rest and prevent injury. So once that you have to use that for about 3 to 6 weeks, sometimes a bit longer, depending on your re-injury or injury healing. And then in between the sessions, you're going to have hand therapy where we will introduce you exercises such as gradual or graduating tendon gliding exercises where we just get your tendon tendency to breathe a little bit more, to loosen up a bit more. And then when your wrist is ready, we get you do some strengthening exercises. For we begin with mild, then we get strengthening all the way up until you can use your hand like normal again. Of course, every session we're going to have ultrasound therapy as well, and that will cause your accelerate your soft tissue healing. Soft tissue healing here means you see A, which is your synovial sheath and your tendons for it to heal faster. Patients take typically anything from 4 sessions to 8 to 12 sessions to recover, right? And this is what we do for hand therapy for mummy's thumb, the Quervain tenosynovitis. If you have any questions for me, please comment down below and I do my best to answer all your questions. Thank you. Take care. See you guys. Bye.